Cable Bahamas has always been considered the innovator.
People can have confidence in Cable Bahamas as a mobile operator because of our past history. We've proven to the Bahamian community that we are in fact able to manage additional services as a telecommunications company.
Customers expect the best from Cable Bahamas.
The technology that we bring is revolutionary technology because we know that the Bahamian public, they deserve it, and Cable Bahamas is here to bring it to them.
We are ready. Turn us on.
Government will not introduce a new tax to support national health insurance just yet. This as a few existing taxes are set to be eliminated. A 21-year-old woman dies after being shot on her front porch, and a local organization is asking Bahamians to support World Hunger Day. We've got those stories and more coming up tonight. I'm Dana Smith, and NB12 starts right now. Tonight, as residents and businesses continue to come to terms with value-added tax, Prime Minister Perry Christie announced today government will not introduce a new tax at this time to support national health insurance. Christie, who made the revelation in his 2015-2016 budget communication in the House of Assembly, said government will phase in initial NHI services for all Bahamians over the next 5 years, beginning January 1st, 2016. However, he said the journey to full national health insurance will take longer. Vonnie Toot reports.
Amid concerns that Bahamians would be further taxed to fund national health insurance, which will be rolled out in January 2016, Prime Minister Perry Christie revealed today that government has no intention of imposing additional taxes to fund the controversial plan at this time. Christie said he is personally committed to having universal health care in the Bahamas and called it the single biggest development in the history of the country post-independence. However, he said it cannot be rushed.
The implementation of national health insurance must be phased in a way that is both practical and affordable. The government will not impose additional taxation or contributions to fund national health insurance at this time, but rather the introduction of services will be done in parallel with our ability to pay for those services. Simply stated, I'm rolling it out. Of that you can be assured.
However, it is still unclear how much the scheme will cost and which category of people will be the first to benefit. Christie's budget communication in the House of Assembly comes weeks after Chief Medical Officer Dr. Glenn Benaby said government is considering a payroll tax of no more than 3% to help fund NHI. The opposition has made it clear it will reject any NHI tax. However, Christie says F&M MPs think he's stupid.
They're looking for fight. Looking for just want to fight me. I don't understand, Mr. Speaker, why some people think we're stupid. On one hand, we're doing this extraordinary job in bringing the economy back. Yeah. And then on the next hand, they expect us to do something stupid to plunge it back into recession. Why do they think we're like that?
Christie says the plan is to phase in initial NHI services beginning January 1st, 2016. The Prime Minister says this will happen over a 5-year period, but noted the full journey to full national health insurance will take longer.
We have recently established a task force to direct and lead the implementation of NHI. This task force provides, Mr. Speaker, for an advisory body that will be appointed, that will include representation of private sector interests, civil society stakeholders, amongst others.
Christie said the challenge of providing universal health care will also require a commitment from local health care and insurance providers. In the meantime, he said he will soon announce the appointment of a CEO to oversee the NHI rollout, as well as efforts to strengthen the existing health care system.
The introduction of universal health care will be the single biggest development in the history of this country post-independence. And the government proposes that it will happen in a manner that strikes the fairest balance between the various competing interests.
The Bahamas Insurance Association chairman said recently, NHI could risk our way of life and our economy if not implemented properly by the government. However, Christie urged all skeptics to consider this.
As each of us sit fully protected by the insurances we have, I only ask, Mr. Speaker, for those of us to reach out in their minds and see the thousands who are without. There will be no surrender to the notion, and there will be no retreat.
Reporting for NB12, I'm Vornik Tood.
Also coming out of the Prime Minister's budget communication, the announcement of a number of tariff and excise reductions as a result of value-added tax. Kyle Joaquin tells us more.
During his budget communication, Prime Minister Christie announced a number of revenue measures, many of which he said are designed to provide tax relief to all Bahamians. For starters, he said the government can now begin to pay back to the Bahamian people some portions of the dividends from what he has dubbed a successful VAT regime.
We promised that we will watch carefully as a result of the introduction of VAT, and we will take incremental steps to begin the process of eliminating taxes on people. And that's what we're doing now.
That's the Prime Minister announcing that the government has agreed to the elimination of duty on several items, including medical equipment and supplies, bicycles, burglar alarms, and audio equipment used by churches. It's just one of the results of what Christie called a successful VAT regime and smooth implementation. On the basis of experience to date, the Ministry of Finance projects the government will hit its current VAT collection target. That goal had been set last year at $150 million. But while he gave no exact figure as to how much has been collected thus far, Christie says as a result of VAT success, the government has decided to reduce the rate of some taxes.
Mr. Speaker, duty rates will be reduced on certain imports, such as canned and frozen vegetables. The maximum rate of duty on motor vehicles is being reduced from 85% to 65%.
In addition to that, taxicab owners can now import used vehicles up to 3 years old duty-free. But with those reductions, the government is also placing a ban on the import of some vehicles.
That said, for environmental and safety reasons, Mr. Speaker, we will ban the importation of wrecked vehicles and the importation of vehicles more than 10 years of age.
As for those in the construction industry, the government is proposing a 2-year exemption on customs duty for building materials used to repair small homes and buildings in depressed parts of New Providence. As the government seeks to modernize the real property tax regime in the wake of a year of unpaid tax scandals, there are also a few proposed amendments to the Real Property Tax Act.
A reduction in the top tax rates on owner-occupied residential properties with attached rental units. So that person who got a duplex and renting the other side, Mr. Speaker, he has relief.
There is also the proposal of more pronounced property tax relief for pensioners in mid-value properties and the introduction of a 10% discount for residential property owners who pay their taxes early each year. According to Christie, the GFS deficit this fiscal year is now estimated at a level of $198 million, a decrease of $88 million from the $286 previously forecast. He added that government is now disciplined in holding total spending to just under the level projected in last year's budget. The government projects total recurrent revenue on the order of $2.074 billion for the next fiscal year, some $100 million higher than was projected for 2014-2015. Reporting for NB12, I'm Kyle Joaquin.
Faced with a youth unemployment rate of 31% and a rapidly increasing murder count, the Prime Minister also today announced government will seek to tackle unemployment among young people by spending $20 million under the Ministry of Finance in conjunction with the Urban Renewal Program. He called youth unemployment a grave problem.
My government also places high priority on measures of intervention in respect of our youth at risk, where proactive, preemptive action can make a difference between a productive life and one of crime. This budget, Mr. Speaker, includes a $20 million allocation under the Ministry of Finance to address youth unemployment in conjunction with the Urban Renewal Program.
The Prime Minister said many young Bahamians lack the training and basic skills that are required to take advantage of the future employment opportunities expected to emerge as the economy recovers. The first of these interventions, he said, is the establishment of a special school for young people with behavioral issues which make them unemployable. Well, the FNM not impressed with the Prime Minister's budget communication. St. Anne's MP Hubert Chipman said if the Prime Minister were to take out all the political rhetoric, his communication would be nothing. He went as far as to call it a no-hope budget.
Just be real with the people. Don't paint this picture that you know you're going to come back to me next year and say, okay, well, it's an election year as far as I'm concerned next year. You will have probably all kinds of concession. You thought you had concession this year. Wait till next year. Pie in the sky, promises after promises. That is the reality of what we heard today.
Free National Movement Deputy Leader Peter Turnquist said there were a number of things he wished the Prime Minister would have elaborated on, like how the government plans on tackling crime, mortgage relief, and how much was generated from Junkanoo Carnival.
No matter what the government says, the only real relief for mortgages, the mortgage arrears problems, is to create jobs. If you don't have a job, it is very difficult to qualify for any mortgage relief program. Because the first question is going to ask you, even if we restructure this loan, how are you going to meet the restructured payments?
Meanwhile, opposition leader Dr. Hubert Minnis says with respect to NHI and its taxless implementation, the government seemed to have followed the advice of the opposition.
They must strengthen the problems that we see at Princess Margaret Hospital in terms of the emergency room, where 60,000 patients are seen there annually, and 15 to 20% patients that come into the emergency room leave without being seen at all by a doctor, a nurse, or anyone. Those same individuals present themselves at a later date, either in a worse medical condition or present themselves dead. These are issues that has to be addressed. He has finally adopted the FNM's position.